Summer is heating up soon, and while we all love a little fun in the sun, protecting your skin is a must. But with so many sunscreens on the shelf, how do you know which one to choose and which one really works? Dr. Sethi is joining us today to shed some light on how to pick the correct sunscreen to help keep your skin safe. Welcome, Dr. Sethi. Good to have you.
Rachel.
So excited to have you. We've talked about sunscreen quite a bit on this show because it is so important to keeping you safe. Tell us about what people should be doing.
Yeah, so first of all, you have to wear sunscreen every day. And even though we're talking about it right now, it doesn't mean that you only wear it in the summer. But when people are picking a sunscreen, it can get really confusing because there are so many options. And most of them look at the SPF number. I know that's the most common way that people pick their sunscreen. But actually, that is a little misleading in the sense that it doesn't tell you how strong your sunscreen is. So I'm going to talk about what are the aspects of sunscreen you should look at when you're picking one. What's the right kind of sunscreen for children, pregnant women, nursing mothers, and so forth.
Okay, yes.
So going into that, again, coming back to what the SPF is. So according to the FDA, for sun protection adequate enough to give you protection from skin cancer, you should have an SPF of at least 30. But what that really means is, if you think of sunscreen as a piece of cloth or fabric on your skin, it's talking about how long you keep that fabric on your skin. So it's referring to the amount of time it takes before you get a sunburn on the screen. And that actually just refers to protection from UVB rays that are responsible for sunburns. But it doesn't talk about UVA, which is responsible for aging your skin. And when you are looking at your sunscreen, turn it around, look at the ingredients, and it's the concentration and the strength of the active ingredients which tells you how strong your sunscreen is. So again, going back to that analogy of fabric on your skin, it's like thinking about, well, if you were going to pick a fabric to protect you, would you pick a gauzy, light fabric or something that's more opaque? So that's what the active ingredient tells you, and its concentration. For sunscreens, we have the option of physical barrier sunscreens, which are called mineral sunscreens, or chemical sunscreens, which are never actually called chemical sunscreens because that is very off-putting. But the difference is of mineral or physical barrier sunscreen sits on your skin. It doesn't get absorbed in your skin, which is a good thing, and usually has ingredients like zinc oxide, titanium oxide. So if you see those words, you are using a physical barrier sunscreen. But the concentration of zinc or titanium should be about 20%. So if you're getting less than that, you are likely not getting enough protection. So that piece of cloth is not opaque enough.
I've heard that once you get to a certain SPF, like you should just be reapplying instead of trying to buy like a 200 SPF, whatever.
Right, exactly. Yeah, so the higher the SPF number, the more difficult the sunscreen is to apply because it gets very pasty, and actually the incremental increase in time of protection from like an SPF 30-40 to like an SPF 70 is actually just a fraction. So if you were to pick something, look at an SPF of anywhere from 30 to 50. Those are usually applicable. And then the other thing is look at the concentration, because that's actually the best way to know how much protection you're getting.
Okay, gotcha, absolutely. Now, should people with different skin types be choosing different kinds of sunscreen?
So that's a really good question. Typically, if a sunscreen has a very high dose of zinc or titanium oxide, which means a lot of protection, it can have a little more white cast and it can get a little pasty. So in my sunscreen, for example, we added just a little bit of tint to make it just kind of blend in better. It's still very soft, and it takes a lot of effort to formulate to make sunscreen really nice and spreadable. But those are some of the things that you should look at, and it's possible to find those. So yes, a little bit of tint will actually help, and then the other thing is also, coming back to the chemical versus physical sunscreen argument, chemical sunscreens go into your bloodstream. They have been found in breast milk, and chemical sunscreens are banned in Hawaii, Australia, because they actually kill the barrier reef. So if that's happening, you likely don't want that in your bloodstream. So pregnant women, nursing moms, children, or everyone should actually be picking a mineral or physical sunscreen.
Okay, great to know. So important there. And then I'll quickly ask you my last question, which is what should we do for the kids?
So for kids, yes, that they love playing outside, and reapplying is probably not on their agenda. So again, physical barrier sunscreens are great, and look for ones that are sweat-proof. There's quite a few, and an SPF of about 30 to 50 still very appropriate. You do have to try and reapply, but again, it's really important to pick physical versus chemical.
Okay, for kids. Perfect. Wonderful. Well, Dr. Sethi, if people want to visit you or they want to learn more, where can they find you?
So they can look at my website, renewmdwellness.com, or they can also listen to my podcast where I have a lot more information on sunscreens, which is the Skin Report.
Wonderful. So great to have you as always. Thank you so much. Ready for summer. Yes. Thank you. Thank you. You can learn more at renewmdwellness.com. That is Dr. Sethi's website, or we'll post it all on ours as well, liveinthebay.tv.